Our topic is mental health of nurses during COVID-19 pandemic, a community assessment. Mental health of nurses in vulnerable situations has great influences on their patients' mental and physical well-being, so we decided to determine the mental health that nurses experienced during the COVID-19 pandemic, which effects of workplace parameters on mental health of nurses in the world, so to where I previously worked. The community is made of nurses who are working during COVID-19 pandemic, the nurses facing challenges with mental health due to the stress of pandemic, and the nurses need support to help address the mental health challenges. Why have we chosen this community as a focus for a particular assessment is the community appealed to us because I believe mental health is a critical issue, particularly under times of stress and disaster. Due to the nature of the profession, we also believe that nurses are susceptible population when it comes to mental health. Imagine nurses infrequently on the front lines of treatment, witnessing and experiencing stressful and traumatic events. We believe it is essential to support nurses' mental health throughout this time, in order for them to continue to care for others. The Make It Off campaign is the community development political action effort that comes to our mind. This campaign is a nationwide public awareness effort aiming to decrease mental illness stigma. The kind of assessments is we would advocate undertaking a needs assessment to determine the requirements of nursing in the future, community development, or political action. The focus is to get information regarding the mental health status and try to improve it. Methods of assessment is mental evaluation, mental history, physical exam, and cognitive evaluation. The tools are questionnaire, survey, interview. Resources are advocacy, effort, professional support group, and educational programs. Assessment needs is to identify the mental health, to identify the effect of stress on daily basis, to identify the signs of depression and anxiety, to identify the need for counseling, and to identify the level of exertion. Why would we do this type of assessment? Is the problem a health issue-based assessment? This type of assessment can be used to collect the data. In this assessment, we can focus on specific health issue because we are assessing mental health processes during pandemic. Access information for assessments are hospital, long-term care, and nursing home, mental health center, and hospice care facility. Now, what is going on? As a result of COVID-19, the mental health of nurses has been deteriorating. Anxiety, worry, and overload are common feelings among nurses. As a result of their experience during the epidemic, several nurses have suffered post-traumatic stress disorder. The identified community strengths are its resilience and ability to adapt to change. The community has a strong support system, which helps to offset some of the challenges that nurses face. The challenges include mental health issues such as anxiety and depression. The community also has a limited number of resources available to support nurses' mental health. Organizations involved or available are the counseling therapy services, community mental health services, support group, and bio-assistance program, and psychiatrists and psychologists. Who are the gatekeepers? The people who can open the doors to help facilitate positive change for mental health nurses are managers and leaders of nursing organizations, as well as those who design and implement health policy. To communicate with these gatekeepers, it is important to be clear and concise about the issue at hand, and to provide evidence-based recommendation for how they can help to improve the mental health of nurses during this time. About the stakeholders, the people who have stake in this issue are, of course, nurses themselves. Other stakeholders include the families of nurses, as well as the patient they care for. To communicate with these stakeholders, it is important to be open and honest about the challenges that nurses are facing, and to provide information and resources that can help them to cope with the stress of the situation. Nurses who are struggling with their mental health during this time, people who are not in the medical field but still affected by the pandemic, voices of people who are not directly affected by the pandemic but who may have ideas about how to support those who are struggling are the idea who may not be heard in this issue. The strengths are, it will allow us to get a comprehensive understanding of mental health of nurses. It will be able to identify the stressor that they are facing and the coping mechanism that they are using. I will be able to assess the overall mental health of community and identify any trends. The limitations are these approaches that it will not give me a complete picture of the community. It will not be able to assess the mental health of nurses during the COVID-19 pandemic. And this approach will only give us snapshot in time and will not be able to capture the long-term effect of pandemic. on the mental health of nurses. Advocacy and ethical considerations are nurses should be provided adequate information about COVID-19 risks. Nurses should be given access to counseling and peer support. Nurses should be protected from stigma and discrimination, and nurses should be given opportunity to voice their concerns.